This drug is given to children, pregnant women, everyone. And yet, it is the #1 cause of acute liver failure. I'm talking about paracetamol. So the question is not if it's dangerous. The real question is, when does it become dangerous? A patient takes paracetamol for pain. Nothing dramatic, no overdose, just repeated doses for a few days. Then nausea starts. People think overdose causes liver failure. That's only half the truth. The real problem is how the liver processes paracetamol. So let's slow this down and make it simple. When paracetamol enters the liver, most of it is converted into safe, harmless compounds. These leave the body in urine. But a small part takes a dangerous path. That path creates a toxic substance called NAPQI, or N-acetyl parabenzoquinone imine. NAPQI is extremely toxic to liver cells. Normally, the liver neutralizes it. It uses a protector called glutathione. As long as glutathione is present, the liver is safe. But glutathione is limited. High doses consume glutathione quickly. Alcohol lowers glutathione levels. Malnutrition lowers it too. When glutathione finishes, NAPQI starts killing liver cells. This is how liver failure begins. Not suddenly, quietly. Now here's the safe rule. Paracetamol is safe only within limits. Maximum adult dose, 4 grams per day. Lower dose if alcoholic, malnourished, or chronically ill. Never mix repeated dosing with alcohol. Pain relief is not worth liver failure. And the antidote, N-acetylcysteine, works only if given early. But only if you understand this mechanism.